I began encountering patients who had pain or illness, but no disease or injury to explain it. And it turned out, and I was fortunate to learn this early in my career, that the brain can cause physical symptoms anywhere in the body, sometimes in more than one place at the same time, of almost any level of severity that can last for almost any length of time you can imagine. And there's a whole different approach to people that have this. But fortunately, if you know what to look for, you can uncover the stress, the trauma, the challenges in life, the emotions that are responsible for this condition. And when you do that, you can help people with it and they get better.
Welcome to another episode of Threads of Enlightenment. As usual, you guys, I always take this time to honor our guests because I know that they're coming with a couple of things I deem very expensive. Their time, 24 hours a day has been granted to every one of us. Our relationship to time will explain a lot about you. If I look at you, I can tell because if you understand the value of time, your relationships change, everything change. The other is the journey. The journey is a powerful creator. It has created the individual that is before us. Dr. Clarke has been through some stuff. We don't come here by osmosis and boom, and here we are. He's been through a couple of things. He's learned a couple of things, and life and the journey has deposited some stuff in him. And we want access to that knowledge, wisdom, understanding so that you and I can become better human spirits while we're here. Doc, thank you so much for coming to Threads of Enlightenment.
Great to be with you, Ken. I'm really looking forward to our conversation.
It is my honor. As I stated before, I would like you to first introduce yourself. Let them, because, we have this tag that we walk around with that mom and dad gave to us when we were young in that hospital, because I remember when my sons were born and I told the nurses, hey, give me a couple of days before I can think of their names. And so for a couple of days, about a week or so, my boys all of them were named Boy Primus. So what was your name or tell us a little about you, and then I'll ask you that question, which I told you I'll throw it to you later.
Okay. Well, I'm a physician. Am certified in gastroenterology. Sometimes jokingly say guts are us, but also internal medicine. And I was destined for a perfectly ordinary career in that field, and I was enjoying it very much. But I began encountering patients who had pain or illness, but no disease or injury to explain it. And it turned out, and I was fortunate to learn this early in my career, that the brain can cause physical symptoms anywhere in the body, sometimes in more than one place at the same time, of almost any level of severity that can last for almost any length of time you can imagine. And there's a whole different approach to people that have this. But fortunately, if you know what to look for, you can uncover the stress, the trauma, the challenges in life, the emotions that are responsible for this condition. And when you do that, you can help people with it and they get better. And it was tremendously rewarding. It was about 1/3 of my patients. The other 2/3, they had garden variety gastrointestinal diseases like ulcers or hepatitis or tumors. But this other group, this 1 out of 3 of my patients, ended up being among the most rewarding personally and professionally because they were not getting what they needed from the rest of the healthcare system. And some of them had been ill for decades. And to see them improve was just remarkable.
Yeah, I can't wait for us to get into that aspect of our conversation because I was one of those guys and I had to learn mine was migraine and they ran all kinds of tests on me to figure out what was wrong, what wasn't wrong, where is it coming from, and all these different things. And I had to learn about my quote unquote triggers. And as I recognized what they were and how they came about and what's all of those different things, I then had the opportunity to begin to control all of those migraines and the onset of them. And some days, Doc, I would fail because I get too busy. And next thing I know, I'm curled up in a corner and smells and lights and everything has a different connotation. So talk to us. I was going to level that question to you, and I usually do it all the time, is how do you serve mankind? But you kind of put it out there and laid it to us so that we have an understanding of it. And I want to go back, though, I want to go back to your beginnings. I always tell people I like starting to the beginnings of our beginnings. And usually, Doc, that's where our family is. In this unit, this is the first space, if you will, that every one of us start our life, exit from the hospital. This is where we reside for most of our time for a few years until we start moving forward to our life. But in this space right there that we call family, we're going to learn a couple of things. We're going to learn how to process our thoughts. We're going to learn about behavior. We're going to learn about communication skills. We're going to learn a bunch of things. And from that space, we start developing perspective, which will then guide our life, guide how we speak and all these different things. What was your family unit like?
Oh, I come from a place where I had almost every imaginable privilege, I have to say. I mean, I was born into a prosperous family. My father worked for a large corporation. And in fact, for a few years, we lived in Venezuela, not too far from where you started out.
Yeah.
Then came back to the United States, also lived in the United Kingdom. My parents remained married through almost 60 years. I got an excellent education. The number of barriers that were put in front of me were relatively inconsequential, especially when you compare them to what my patients had to deal with. So when I first encountered a patient that had these brain to body conditions and the level of stress and trauma that they had been through, I was starting from absolute zero understanding and knowledge.
Yeah.
And it just, as a physician, it was embarrassing, frankly, to have gone through 7 years of training and not to know that your brain could produce illness in the body, that the level of trauma and adversity that was out there that people had struggled through, that they were mostly keeping to themselves, that
Yeah.
few other people outside of their immediate family knew about. I had to get an education from my own patients on this, and from listening to them, it was quite a journey to hear all of that. I often tell people that I had 7,000 teachers over the years, and these are my patients who shared their lives with me and enabled me to understand so much more about humanity than I ever could from my own life.
So let's jump straight there, Doc, because we know that the 7 years or plus of studying in medical school and getting all your degrees and so forth. Can you remember, because this, I'm sure you have glimpse of this and probably uh, 2020, can you remember your first patient that showed up in your office and now began to question your world? It'll go, it'll build up. But do you remember the first one that showed up and all of your knowledge and your studies did not prepare you for what you were encountering in that session?
Yeah, it actually stands out very well. I have no doubt that I completely failed to appreciate what was going on with many, many patients before I met this woman, but she
Hmm.
was 37. I was in year number 8 of my formal training. And, this is
Wow.
another embarrassment to me that I went so far without knowing
Yeah.
anything about this. But she was averaging for the previous 2 years, one bowel movement per month,
Wow.
taking 4 different laxatives at double the recommended doses. Already
Whoa.
fully evaluated, or so we thought, by
Yeah.
another university, came to us at UCLA for some highly specialized testing of the electromechanics of her large intestine. My department chair and I, we that test was going to show what her problem was, because as far as we were concerned, no other explanation was possible for this terrible condition. But that specialized test, was normal also. And so it was left to me to do her exit interview and essentially tell her she was going to have to live with this. But
Yeah.
I asked her about stress one more time. She didn't have any. She was happily married. She had 2 children. She worked part-time in a bank. No significant stress going on there. So I just happened to ask her, what about stress earlier? Thinking, maybe something had happened 2 years ago, 2 years
Yeah.
before, that could have triggered this. And she interpreted the question to mean the more remote past and told me that her father had molested her.
Oh,
And
wow.
I'd never heard that from a patient before. I had no
Yeah.
training in how to respond to that. I was immediately concerned that if I asked her about this, I would make her worse. But we were absolutely at the end of knowing what to do for her. So I fell back on basic training for a doctor and took a history. What did he do? How often did he do it? It turned out to be one of the worst stories of abuse that I ended up hearing throughout my entire decades long career.
Wow.
And once again, this had stopped happening when she was 12. So
Hmm.
25 years had gone by. Um, and could it possibly be connected to her condition? Had no idea.
Yeah.
And nobody had
Yeah.
ever mentioned this to me in all those 7 years of training. But there was a psychiatrist named Harriet Kaplan at UCLA at the time, and I had vaguely heard that she was trained in medicine, had an interest in this kind of problem. So I sent the patient. I was very glad to have a place to pass the buck, frankly,
Hmm.
to be able to do something for this patient. And I forgot all about her and went on with my career and putting endoscopes inside people and figuring out what was going on with their bodies. So 3 months later, I run into Dr. Kaplan in an elevator. And this was the elevator ride that changed my career because
Yeah.
between the ground floor and the fifth floor, I learned from Dr. Kaplan that she had cured this patient with about 10 weeks of hour-long counseling sessions.
Wow.
Absolutely blew my mind. And, got off the elevator, turned around, said, Harriet, how did you do that? Because, the idea that you could alleviate a serious physical symptom, absolutely
Hmm.
real symptom, just by talking to somebody, never heard of that as being possible. But I wanted to be a complete doctor. So I ended up, prevailing on Harriet to teach me her framework for how she thought about patients like this. And my career has never been the same.
Wow, that's a interesting story. And being a truthful story, they say truth is something else, isn't it? So here is this: you were shielded from this knowledge, if you will, because of the lack of training. They don't train physicians to come out of the body, if you will. They look at all the body mechanics and don't see the correlation between this. But I can't understand how the system does that when they have the data, doc, such as placebo effect is about the mind, doing something that is, so it's kind of odd that they would not go deeper into that aspect and begin to make you guys, the physicians of the world, if you will, to be more aware of the importance of the mind and the body. It's really an interesting conundrum that you have within that industry, if you will.
Yeah, it's
So
it's
here you,
worse than odd. To me, it's appalling. I mean, this is
yeah.
40% of people who go to a doctor. This is what they have. The
Mm.
number of people with this is twice as big as the diabetic population.
Oh,
In the United States, it's 50 million adults that suffer from this,
wow.
and they just wander from pillar to post trying to get help for this. One of the board members of my nonprofit was disabled by migraines for 6 years, and he had access to some of the best specialists in the Los Angeles area, and
Mm.
not a one of them assessed him for these issues.
So when you were made aware of that data, that approach, if you will, what did it do to you? Because you made a statement that you wanted to be a more holistic, a round knowledge doctor. What did that information from your colleague do to you?
Well, I thought, that there were going to be maybe a couple of patients a year that would
Hmm.
suffer from this kind of problem. And when I encountered one of them, I wanted to know what to do, just how to do the basic assessment of someone with this so that I could then refer them on to a specialist like Dr. Kaplan to take care of them from that point. Never thought it would be very much of a part of my practice, but I didn't want to be ignorant. I'm somebody who
Yeah.
doesn't, like any human being, I don't like to be ignorant, especially when it's a core function of my profession. But I was wrong on two counts there.
Yeah.
Number one, I was wrong about the number of patients because whenever I had a patient with symptoms and I would do my diagnostic evaluation, I would do the tests on them, and I didn't find anything wrong. And then I would use the framework that Dr. Kaplan had taught me, and I would look into whether they might have a stress or a trauma in their life. And I was finding it over and over again. People you would never
Oh, yeah.
guess. I mean, you could be working at the next desk and
Yeah.
you would never know the burden that they were carrying. But because they wanted to get better, they would share these very personal details of the issues that, and some of the stories were just astounding.
Horrific.
And what was
Yeah.
really astounding is that there were 5 or 6 of them every single week,
Yeah.
week after week, 250 or 300 patients a year that had this, not 2 or 3 that I had guessed. And then my next area of error was I would send these patients, diagnose the psychosocial issue, send them off to a mental health professional where in the United States, what they get is cognitive behavioral therapy for the most part. And it turns
Mhm.
out that doesn't work very well.
Yeah.
Dr. Kaplan was doing something
Something
at a
different.
higher level of care, more insightful, going into more depth in the person's life and the issues. And what I came to find as I worked through this, that a lot of these patients have learned things as children about themselves that are simply not true. They are
Yeah.
carrying false internal assumptions that make their lives as if they are swimming against the tide. And I'm confident you have seen this in many of the people
Yeah.
you've interviewed for this podcast. So
Yeah.
they would go and get cognitive behavioral therapy, which doesn't help you for these issues. And the patients would often come back and say, I tried it. I'm not any
Yeah.
better. Now what do we do? And so I tried. And I was I'll admit very freely that I was a bumbling beginner when I started. But the ideas that I had learned are so powerful that people were getting better,
Yeah.
and
I
I'm
mean,
sure I made a
it's a
lot of
new.
mistakes, but they got better.
Yeah, it's new. You weren't ever exposed to that, number one. I'm sure the type of physician you are, and from talking with you in such a brief moment, you can tell that you were concerned about your patients, especially when you're handing them off to someone else and you're not able to really truly follow up on that to see what is going on until that individual comes back and say, "Hey, doc, I tried it. It is not work." So here you are, then have to regress and then begin to start again, basically addressing that individual and collecting your data. Of course, you're going to take a couple of feet steps up front, back, and all this kind of stuff until you, from the amount of patients coming in and the trial and error, you will then begin to see and develop a process by which you know works because you had enough data, if you will, some enough patients there that you can streamline and get that information. But so from talking to you, Doc, and again, I came out of the healthcare system, and it shows how negligent we truly are in that system when it comes to the individual. We are not doing what we should be doing and taking care of the whole being. And we need to reevaluate our approach. And I'm going to talk to you later on about that if we are doing that at any level. So here you are, saw something, you send out, and you're recognizing that this thing is real. I'll give you a story, Doc. I remember seeing, and I'm noticing from a layman's point of view, everyone that I dealt with and talked to that had manifested in arthritis in their hands. And I don't know why, but all of them that I've ever talked and they said, yeah, I had unforgiveness. And as soon as I forgive my arthritis, and it showed me that here is a mental situation that manifested in the body. And I tell people trauma is unprocessed emotions that we store in the body. It'll manifest somehow. We don't know based on that individual. That's where that manifestation will come and produce. Here you are, you're collecting the data, Doc. So many people that are in pain as you are moving through, and you said it, you're making mistakes and so forth. But when you began to see it, and what was the process, if you will, that you began to put in place to assist you to bring that desired outcome with that individual on a consistent basis?
Yeah, it took a while to learn this, but I would start with just finding out what stresses the person was coping with at the moment.
Hmm.
It could be something as simple as that, something going on in their life today that was creating stress for them that they simply hadn't connected to the fact that they were suffering this form of illness. Very simple
Yeah.
example was a gentleman who'd been ill for 9 months, and none of his doctors could figure out why, until I focused in on exactly when and where he was having his symptoms. And it turned out he only got them when he was driving to work. When he was
Hard to
driving
believe,
home
isn't it?
from work, he was fine. I mean, so you're diagnosing him right now, and that was completely missed by the healthcare system. They just not knowing to look for this sort of thing. So he was so relieved when he saw this connection. Just
Yeah.
knowing it was enough to provide a lot of help for him. But more importantly, he was able to go to his supervisor and say, "We need to make some changes here because this is making me physically ill." And so that was a very successful outcome. Another patient, he had back pain. This is a very common condition in people with stress-related conditions, pain in the
Uh-huh.
lumbar spine, the low back. He had it every single day for over 25 years. At least that's the story he told initially. But it turned out that 2 weeks out of the year, he had no symptoms. And you can probably guess what he was doing during those 2 weeks out of the
It's
year.
vacation.
Exactly right. You diagnosed two in a row, Ken. You're on a roll. But yeah, he was, and I thought, okay, I don't want to jump to conclusions here. Maybe he is resting his back carefully on a warm beach, and that's why
Yeah.
it doesn't hurt. But no, he was fly fishing in British Columbia. So he's
Yeah.
out there in the river. He's moving back and forth to cast the fly. He's bending over to net the fish. And then
Hmm.
he tells me, at the end of the day, when he's finished with his time in the river, he helps the lodge owner clear brush from behind the lodge. And is he having any little twinge going on in there while he's doing this? Not a bit of it. It's only when he gets back to his usual day-to-day existence that the pain comes back. So,
Wow.
it's very clear that was a stress-connected issue. But, more complex situations, I quickly found that majority of my patients, the illness or pain was connected to adverse childhood experiences, or ACEs,
Yeah.
we call them, which can be anything you would not want for a child of your own, essentially, that you would not want a child of your own to go through the same things that you did. And by the way, I should say, for anybody who's watching, who's interested in whether any of these issues connect to their own story, we have a 12-question self-quiz on symptomatic.me that can help people understand if anything that we're talking about today could apply to them. But that was a big area, was just to ask people, were you going through stress as a child? And if so, is it something that you would never want for a child of your own? And very often those stories were there. And it could be, a whole range of different things. Sometimes it would be like the sexual abuse of my very first
Yeah.
patient, but other times it could be a lot more subtle. It could be seemingly not nearly as damaging, but in the
Hmm.
long run, absolutely every bit as damaging. One of my patients, after quite a conversation, he realized that when he was young, he only got praise from his parents when he did something better than his brothers and sisters could do it. And he had
Wow.
3 very accomplished siblings. So it wasn't easy to
Yeah.
exceed their capabilities. And consequently, he just went through his early years thinking he was worthless. And it had impacts on him long term that were quite damaging, very similar to my other patients who've been through childhood trauma of one sort or another. The good news is that those issues can be addressed successfully, and when we do that, physical symptoms improve.
And
The last
Doc,
3
I always
parts, I'll
tell.
just say very briefly, I look for
Yeah.
depression, anxiety disorders, and post-traumatic stress to sort of complete the evaluation.
Yeah, there are programmers that I tell people that we have to be aware of. We have the society, we have the religion, we have all these things, but depression, stress, all of these things are programmers. Trauma is a programmer that resides with us. And the trauma, Doc, usually, as you are so eloquently speaking to, that many of us suffer when we were young and we internalize it. We didn't know how to deal with that particular situation that caused the trauma. And it caused us to internalize that incident, and there's no expression of it, but it resides there. And as I said earlier, that it will manifest. It has to, because it's all energy stored within this body of ours, and it'll come out in a form And whatever dis-ease that form comes out, it will come out. And to have someone like you and your team that you have with your organization that are able to revisit those areas and times when people have trauma to bring them back to that place of healing. There's not many of you out there, Doc. I mean, we have it's a serious situation when you're talking about the tremendous amount of need that is out there and the trauma that is out there, and we are experiencing, and people are experiencing trauma in such a degree uh, um, in on the planet, and yet there is such a small amount of you and your team that is out there to service, if you will, all of that. Let me ask you this question, Doc. I know that you put the organization together for that. How have you guys, I don't know, again, I'm just tossing a question to you. Is this such an impact on you that you are trying to, you and your team trying to create micro teams like what you have? So because of the vastness of the demand, if you will, there's no way that you and your team can handle all of this. How is that being received within the industry that you are in today?
It's being received really well. Once people find out about this,
Hmm.
they absolutely love it. We teach a lot of doctors and mental health professionals as well as the public. And we do try to leverage the knowledge that we have because you're right, there's only several hundred of us that are doing this work, as a profession. But we've put courses on our website. We've got recorded conferences with international speakers that come to it. We have a self-treatment course. There are numerous self-help books available. There's an app called Curable out there that is, very well designed. So we've got a lot of resources. I just started a podcast of my own called The Story Behind the Symptoms, where I interview patients to
Yeah.
show how I used to do it in my office. But the doctors in particular, once they learn this, once they see this in their patients, they can't unsee it, but they absolutely love what it does to transform their practice. One doctor took me aside at a conference and said that these ideas had put the joy back into her work
Back in, yeah.
because it
That's
goes from
beautiful.
40% of their patients, two
Yeah.
out of five of their patients that have these problems that they weren't initially taught how to cope with and that are a source of huge frustration and even burnout for doctors because the patients have real symptoms, whether it's migraines or irritable bowel or fibromyalgia or long
Hmm.
COVID or any of a list of scores of different symptoms that people can get. But their diagnostic tests don't show anything wrong. In fact, that was the title of my first book. They can't find anything wrong. And it's hugely frustrating for doctors. So if we give them a way to assess people with this problem and help the patients to make progress with it, it just transforms their ability to heal.
That is awesome, Doc. I'm so glad to hear that. And for all you guys that are listening, I'm going to make sure that we provide this. We're going to, uh, all of the links and the information that you need to get to Doc and his team, because it's freedom is at the end of this information. I always tell people the freedom, because I had someone question me about what I mean about that. When I say to them, when one holds on to their perspective that has kept them in bondage, for lack of a better word, Doc, and when you are with that physician, that individual that is able to move you and your perception to come to that space, as you talk about many of your patients, when they saw, when you were able to move that table and that needle, for them to recognize, especially the gentleman with the work, to recognize the source, if you will, there is a degree of freedom that that individual will encounter and be able to deal with the situation from there. And because I tell them the principle is this, and you shall know the truth, and the truth shall set you free and make you free, because that's the situation. And again, the truth is based on your situation. Whatever you're going on in your life, there is that truth in there. And once you locate it, based on whatever trauma that you had, you get your freedom. And there is a degree of peace that you can navigate from all of the madness that had kept you in that place before. Here you are, Doc. I love that you're out there educating the physicians out there. Is there any way that this can become a part of the curriculum? I see you laughing, but I gotta ask, is there any way, because this is the source where the production of doctors are coming out of, coming from, is there a way anyway, somehow, that you think there would be some give in allowing someone like yourself or some other physicians that can be professors or teachers to make the young ones coming up aware that 40% of their practice is going to be suffering from something like that, and to make them a better provider, physician, anything like that?
Yes, absolutely. That's what the Association for Treatment of Neuroplastic Symptoms is all about, is making this knowledge routine for both medical and mental health professionals. The medical professionals typically haven't in the past learned about the psychological principles of this work, and the mental health professionals typically are not comfortable with people who are physically ill, people who've got chest pain or belly pain or pelvic pain. And so these patients fall into this giant blind spot in the healthcare system. But we've had a strategy around this, and the first domino to fall was to get some research published about this, we would subject the ideas that we have for diagnosing and treating these patients to the rigors of a clinical trial. And we eventually persuaded a group in Boulder, Colorado, to do that, to take two control groups and a third group that used our psychological approach on a group of patients who'd had back pain for a decade on average. So this was a very severely afflicted group. It was going to be a real test of whether the approach that we advocate was going to work. The researchers, frankly, were skeptical. I mean, we had to really tell them, no, this works for us. But all we could share was, just thousands of patients that we had individually treated. But that's considered what's called anecdotal evidence. It's not a clinical trial. But we eventually persuaded them to do this. And what they found was that with just 8 sessions of neuroplastic psychology, we call it, the patients with the 10 years of back pain, and this was just in 4 weeks, 75% decrease in their pain. The research and the other the two control groups barely budged in how much pain they were having. So it shocked them. I mean, this was a vastly bigger level of improvement than had ever been seen before with any kind of a talk therapy approach. They did a couple of other things in this study that were important. Number one, after the month of treatment, they followed the patients for another 11 months to see if the pain would just come right back. It did not. And I recently spoke to the researcher, and he's now gathering data from 5 years of follow-up to see if, did it come back after 5 years? And he tells me that his preliminary numbers are it has not come back. So just really an astounding, 10 years, these people having pain, and then boom, 75% improvement.
75%.
So
that's incredible numbers.
Yeah, so we took that research, unlocked a lot of dollars for more research, and there are studies now from Halifax, Harvard, Detroit, UCLA that are corroborating this. And so to get back to your original question at long last, how do we get this into training institutions? We show them the research, and that unlocked the door, and I'm now teaching in my local medical school. There are a couple of medical schools in Europe that are using this. That book I mentioned, They Can't Find Anything Wrong, is being used as a textbook at both medical schools in Slovenia, of all places.
Wow.
So it's starting to happen now that we can point to a solid research. That's what moves the needle for people who design professional curricula.
Yeah, and that the back industry, as far as back pain, that in that industry alone.
Don't get me started.
It's going to be a little upset with you.
I hope so. I hope they're running scared because, one of my colleagues in this field is a spine surgeon. It's a fascinating story. He was aware that when you operate on people for back pain, without nerve damage, but just pain, outcomes of that are terrible. It's terrible, like 25% of people get better. And so he thought, well, this is, I want to improve on this. So what I'm going to do is I'm going to have my patients see a psychologist first for what he calls prehabilitation. And he was thinking that the outcomes of the surgery would be better if the patients had this psychological preparation with his psychologist. Now, it was a great idea, but it didn't work out quite as he expected because the psychologist was curing his patients right and left to the point where he eventually got a phone call from the operating room director at the hospital and said, "We are not seeing you over here nearly as much as we used to. We've got this beautiful spine surgery operating suite, and it's sitting empty a lot of the time. It's a very expensive space. What in the world is going on?"
I'm sorry, I'm laughing because I know I've been in those meetings and stuff like that when they're talking about their fancy operating rooms and stuff like that. And to hear that story in relations to that is just priceless because it is an industry that is designed to just keep you coming back, if you will,
Well, and
and not
everybody's
anything.
focused on the body. And it also is the case that if you take people who have no spine symptoms at all, no back pain whatsoever, and you x ray their back or you do an MRI of their back, just from the normal aging process, there will be abnormalities there. They're
Hmm.
not causing any problems, but you will see them. So if somebody with one of these minor abnormalities happens to have stress related back pain and goes to a back surgeon, and the back surgeon does an MRI, if you're over the age of 40, you've got more than 50% chance that something will be wrong with that x-ray. And
Yeah.
the spine surgeon is going to go, "There's your problem. It's not the problem."
Yeah, let's do an operation for that. Here you are, Doc. You've done this and you've accomplished all of these accolades that are there. And I want to talk to something that I know because I know that also is a big industry. And for me personally, the migraine, that's one of the sufferers that I had as a young man to the point where I remember when the first onset of it came, I was walking in the street and kind of like blacked out. I started smelling 100 miles away the sound. I was standing at a light, actually stop light, and the lights, everything was just blaring, and this migraine came. And next thing you know, I woke up and I'm sitting inside a building. Someone took me in because I'd gone south from all the onset, just the onslaught of everything coming at me at the same time. And I know you've been around folks like that. Again, that industry of migraine is another one. Talk to us about some of the things that you saw that is common, if you will, within that arena that causes that problem, and how did you guys approach dealing with someone with migraine?
Yeah, the approach is very similar, whether it's migraine or long COVID or chronic fatigue, irritable bowel, fibromyalgia, visual disturbances, ringing in the ears, dizziness, back pain, pelvic or genital pain. The list of symptoms goes on, but the tracing it back to the source is pretty much a similar kind of process regardless of the symptoms. And if it's not stress in the present day, then it's usually linked to adversity in childhood, which we can't go back and change what somebody experienced when they were young, obviously, but we can assess, the long-term impacts of those experiences. And we can then intervene successfully and help people with that. The three main areas of the long-term impact have to do with personality traits, with triggers, and with emotions. The personality traits that many people develop in order to survive the early adversity. Kids in those environments try to be really good little kids. They try to be
Hmm.
perfect. They're very critical of themselves. They work really hard to solve the problems that they find in the family. They are often devoted to the needs of others and helping others that have issues in that family. And as adults, they do the same thing. They are focused on the needs of other people. They don't often put themselves on the list of people they take care of. They're kind of often living on a treadmill that they never step off. And they're just going and going and working hard and paying attention to details and trying to be perfect. And nobody can do that forever. Sooner or later, the body
Stop diagnosing me, Doc.
is
Stop
going to
diagnosing me.
protest. Yeah. Um, all right. So the other two triggers a person, a situation, an event in your life today that is highly stressful for you because it is in some way linked to the past. And the
Yeah.
most common example there is an adult who mistreated you when you were a kid and they're still in your life today. But there are
Yeah.
many other examples. And ironically, one of the triggers that I would see not infrequently was something good that happened to a person. And that was a contrast to how they were treated in the past. And so
Yeah.
it would raise issues of imposter syndrome, where you're thinking, "Oh, this good thing that has happened to me, I don't really deserve it. I must be fooling people. It's not going to last," and that creates anxiety around that. And it can also create the third major area of long term impact: emotions. When you
Yeah.
start thinking, maybe I actually do deserve to have good things in my life. But if that's true, then it means you did not deserve to go through all that adversity as a child. And that can stir up anger, sometimes fear, occasionally shame, grief, or guilt. But the children, in order to survive those early environments, they had to take those emotions that they were feeling back then and bury them somewhere. And
Yeah.
they get very good at it because they're starting at a young age. And so as an adult, when the emotions come knocking on the door, person is typically not consciously aware of it. So the emotions, they have to go somewhere. They go
Yeah.
into the body. And migraines is a big one.
Yeah. That's as you were um, explaining the first, you were talking to me. That's what I was saying, self-diagnosed. You were talking to me because I remember as a young kid experiencing tremendous trauma, and because they were running all kinds of tests. I mean, I remember them doing all kinds of tests and couldn't find anything. And I didn't relay the two until much later on in my life, as when I went on my personal journey and stuff like that. It kind of pinpointed to that handling and dealing with the stress and it manifesting in that fashion in the migraines and so forth, because I remember that particular day when it came on, I actually was talking about that individual, my grandfather, and what he did. And it was years later that came about. And to make peace with that whole situation, I named my last son after my grandfather
Oh,
because I knew that in order for me to stand and be, if you will, apart from all of that, and to show that, hey, I'm okay, was the name of my son after my grandfather. And so I had to come full circle, come back in. And so I'm telling you guys out there that many of the diseases that we encounter in our life, especially when you come to a doc and they're running all kinds of tests, and these tests that are designed to pick up the physical aspect of it and it's not showing up, that's the clue right there that this is here. And that's when you need to have someone like Doc and his team available for you. This has been a really good one for me, Doc. I've enjoyed this interview.
thank you.
I want to ask you something on this line. And again, for everyone that are listening to us, we're going to provide all the stuff for you guys to get access to Doc and his team and so forth. And he talked about several tests that you can take and all the things that are out there. The book, get the book, guys. We're going to provide all of that. And you know how I feel about books. I always tell people, get books that are in line with your situation where you're at. Create like a group and you guys read the book and talk about it. And you'd be amazed at the outcome that you would have as a group as you're moving through and challenge yourself. And Doc talks about all those diseases that we talked about and that there's a correlation with the brain and the mind with them. And many of the women I know out there, fibromyalgia is a big thing. Another one. Ladies, get into the book, get into his space so that you guys can get your relief. Doc, I wanted to know if you guys, you talked about your team putting together and teaching and so forth. Are you guys in the process of developing a database, if you will, of physicians and groups that are in per states around the United States? How is that coming around? Are you guys getting good feedback on that?
Well, yes. We have a practitioner directory on our website, symptomatic.me, of people who have, they're already licensed professionals, but they've taken extra training in this field so that they can provide this kind of care. And we've got, several hundred of them around the United States and around the world that are doing this. And it's growing. As I say, when people find out about this, they want to teach other people about this.
Yeah.
And then the number is growing. I also wanted to comment that, you're naming your last son about after your grandfather is reflective of a tremendous journey on your part. That
Oh, thank you.
many of my patients come out of their early experience not thinking very well of themselves, let's put it that way. And a big part of the journey is to recognize that what you endured as a kid required heroic perseverance, and to accept the idea that you were not a second-rate human being, you were not a worthless person, that you were, in fact, just the opposite. You were a heroic person. And internalizing that self-love is a key part of recovery from all of this. And there is no way you would ever have named your son for your grandfather unless you had completed that journey towards self-love.
Yeah, it took me a while. Thank you, Doc. It took me a while. And I want to tell you guys, personal development is not for cowards. You got
God,
to
no.
look into the dark sides of yourself and learn to accept yourself and love yourself and heal, because we are precious. And I always tell people that we are one of a kind. You are an endangered species. You're so special that their industry is designed on your uniqueness. Have facial recognition, voice recognition, fingerprints. They wouldn't be able to solve a crime at all if we were all the same, So you are unique in every way, that once you leave this planet, that uniqueness no longer exists on this planet, in this realm. Even twins will tell you there is a uniqueness within that individual. Doc, you have a mic. You are connected to all mankind, if you will. There's a couple of billions of us on this planet. And you have an opportunity to say something to us. What would that be?
Oh, goodness. That's a big audience, billions. The basic idea is that the brain can cause pain or illness in the body that is every bit as severe as any other form of illness. It is at least as treatable as any other form of illness. If we start with that simple idea, it would transform the practice of healthcare. This condition was first described in an Egyptian papyrus from 1800 BC, but the quality of care of this condition hasn't changed since then. They were giving people what amounted to placebos for this that didn't have any better benefit than a placebo effect, which is not zero, but is not very effective either. That's what they were using in 1800 BC. It is still what we're using in 2025. And you can go on the internet and you can find scores of different treatments, devices, supplements, various kinds of manipulative therapies, all of which have no better benefit than a placebo, many of which will charge you hundreds of US dollars, and they don't work. And we have randomized clinical trials, the highest level of scientific evidence, showing vastly better outcomes with the new forms of neuroplastic psychology treatment. And it's so far not widely available. It's very, very limited in the number of people that are getting access to it. So that's why I do what I do, is to try to change that, so that after almost 4,000 years, we can give people validated, evidence-based treatment and change the course of medical history.
Doc, I'm going to leave it there. And again, what we're going to do is provide everything. I know personally what that pain feels like. I know personally migraine. I suffered for many years. I know what Doc is talking about as far as the mental connection, if you will, that dealt with that. I've seen personally with, as I mentioned to you earlier, with those that were suffering with arthritis and stuff like that. I saw with my eyes straightening of limbs after they recognized what it was and where it came from. And I watched it in total amazement. And I've seen that countless times. So guys, all of you that are listening, it is imperative that you get in touch with Doc and his team. I'm going to provide all of that. Get the books, get all of those things, take the tests, take the questionnaires, find out where that pain is from, and get the help that you need. Doc, I want to thank you so much, so very much for coming here at Threads of Enlightenment. This has been a good one.
Thank you so much, Ken. It's been a real pleasure speaking with you.
It has been an honor, sir. And I take my hat off to you and the assignment that you have on this planet, you and your team, the assignment that you have to help mankind alleviate its pain in the body as well as in the mind. I thank you so much, and I honor you for your service and what your team is doing here on this planet for us all.
Thank you so much.
Thanks for tuning in to Threads of Enlightenment with Ken Primus. Hopefully you're now feeling more empowered to overcome the challenges in your life, whatever they may be. Share that inspiration with others by telling them about this podcast, rating it, and of course, remember to subscribe so you don't miss a single episode. For more connection, you can find us on Facebook and Instagram by searching for Threads of Enlightenment. Until next time, stay enlightened.